Gum health can be evaluated by bleeding. If there's no bleeding on probing, the area is healthy. If there's just a little point, it's good. A line down the side would be more inflammation, and then there's profuse bleeding that fills up the whole contact area. This is a healthy gum tissue. It's nice and pink. When it's probed, there's no bleeding. Here is a patient that brushes quite a little bit. So his gum tissue doesn't look so bad, but upon probing, you can see that there's bleeding. There's at one point just kind of like a little point bleeding, which you can see on that central, uh, the lower left central incisor, and then the lateral incisor, you can see the line. So that's the difference between a point and a line. The line, though, is usually shows a lot more inflammation, which isn't a surprise because that particular tooth is crooked. It's a little further behind. There's probably material up underneath it. Here's somebody else with profuse bleeding. You look at the gum tissue and it moves very easily with the air. When we probe it, you'll see that the whole contact area fills up like a triangle upon just lightly touching it. And that's a mark that there's a significant amount of inflammation, that the gum tissue, the connective tissue is weak, and really is something that needs some significant work to turn that around. The next case and it has a lot more tartar and plaque. You can also see the irritation has affected the coloration as well. And in this particular patient, when we put the air on, you can also see it move, just like the other one, but the quality of the gum tissue looks a lot weaker. Part of that is that there's just so much tartar and plaque of the biofilm there. We just basically touch it a little bit, and you can see how the whole triangle appearance fills up. So when we're looking at gum health, if there's no bleeding whatsoever upon probing, then there's a point, then there's a line, and then there's the triangle. And the more bleeding there is, naturally, the more gum work a person needs to do. If they go in right away and floss, oftentimes they will hurt the gum tissue. If more of the extreme cases, it's better to have a dentist or a dental professional clean up the inflammation, possibly using a rubber pick. I also like tooth and gum tonic. It's a mouth rinse that also helps to treat the gum tissue.